Hi everyone, I'm Gauri Singh. My leadership project is titled Centering Women in Safer Surgery. In my last role, I was leading technology, training, and innovation for Lifebox. 5 billion people in the world do not have access to safe surgery. While Lifebox has made surgery safer for 248 million patients, there is a need to assess whether the impact has been proportionate for women. My project focuses on answering three key questions. Do female patients have different surgical outcomes compared to male patients? Do female surgical providers get equal training opportunities? And are medical device innovations designed for both male and female users? Imagine a world where your phone is too big for your hand, your doctors prescribe a drug that is wrong for your body. In a car accident, you're 47% more likely to be seriously injured. If any of this sounds familiar, chances are that you are a woman. In April 2024, I was in a room witnessing a focus group discussion to collect user feedback on a surgical headlight that we were developing. The female surgeons were indeed invisible, as there was none in a group of 10 male surgeons. I followed a three-pronged approach to investigate these three questions. The first was interview with global surgery experts, second, secondary data research, and finally, primary data analysis. On the first question, secondary research says that surgical site infection rates differ by gender for certain procedures. The study did not establish a cause and effect relationship. The researchers said the association between gender and surgical site infections was strong and should be investigated further. I analyzed the outcomes of a program to reduce surgical site infections. In 1,000 patients, SSI rate was 8.9% in female patients and 9.2% in male patients. The SSI rates in female patients was more than double in neurosurgical procedures as well as orthopedic procedures, and the reasons for these differences needs to be further studied. On the second question, highlights from the secondary research are that female generally surgery graduates performed significantly fewer cases than male graduates. Further interventions are warranted to promote equitable training opportunities that support and engage female residents. Male registered nurses could be getting a higher pay due to their clinical settings, certifications, or because they specialize in certain areas with higher pay, the report stated. I also evaluated participants' data on training, on teamwork and communication in the operating room. And data for last year showed 52.3% female and 38.4% male participants. However, 72% of female participants are nurses, while only 28.8% of male participants are nurses, as highlighted on this graph. There was also feedback on making trainings more inclusive for nurses by empowering them to speak and share their input. On the final question, the secondary research says female orthopedic surgeons are more likely than their male counterparts to report physical symptoms attributed to orthopedic surgical instruments. There exists an urgent need to address the major challenges they encounter. Unfortunately, there was no sex classified feedback data available for the surgical headlight development. Hence, there is a need to track this data during usability testing and ensuring adequate representation of female users during medical device development. On the outcomes of this project, I intend to make recommendations for making Lifebox programs more inclusive and impactful. And I also plan to publish a research report with the outcomes of the project and present it at major global health conferences. The leadership journey has helped me in strengthening my voice by finding the right sponsors for my ideas, speaking up, and creating visibility for myself. This project will enable me to establish myself as an authentic leader in global health as I initiate dialogue and advocacy around this very important topic. And finally, the leadership project has helped me in building my research skills, which are critical to advance in this space. Thank you so much for your time.